Before Obamacare, Massachusetts had Romneycare, the 2006 law to provide universal health coverage in Massachusetts. So if Obamacare goes away, what happens to coverage here? WGBH's Stephanie Leyden introduces us to a family worried about losing something that has saved their daughter's life.
You'd never know it by looking at her now, but 6-year-old Maddie Nobles entered this world struggling to do the most essential of things, breathe.
She was, I think, as close to dying as a baby can be and come back.
Her condition is a rare one, pulmonary hypertension. It causes the blood vessels connecting her lungs and heart to narrow. There's no cure. But there is life-saving medicine.
Then you just have to wait a few minutes.
Access to medication and treatment is so vital, and the political debate around healthcare so uncertain. Maddie's parents made a difficult decision to leave home.
With the drumbeat to repeal the Affordable Care Act, my husband and I realized we couldn't stay in Florida.
Her big worry that the end of the Affordable Care Act could result in insurance companies no longer being required to provide coverage for people like Maddie with a pre-existing condition. But in Massachusetts, there's a state law requiring that coverage. So, a year and a half ago, the family moved here to Melrose.
Even if the Affordable Care Act is repealed, we've got the Massachusetts state coverage.
But a repeal of the Affordable Health Care Act could test the strength of Massachusetts health reform laws, including the provision to insure people with pre-existing conditions.
The problem is they're talking about pretty universally on the Republican side getting rid of the individual mandate.
Laura Pellegrini is with the Massachusetts Association of Health Plans. She says insurance companies that provide coverage for people with complicated and expensive medical conditions also need healthy customers.
To make this all work, we need healthy people and sick people together in an insurance pool.
It's a delicate balance for the private insurance industry, but the even bigger question, what happens to the state's Medicaid program? Known here as Mass Health, the program is massive, providing health care to nearly 2 million residents. The cost is $15 billion. That's 40% of the state budget. More than half that money, $9 billion, comes from the federal government.
They talk about block grants or per capita spending. I think that is a buzzword for a state like Massachusetts that we probably would lose federal funding.
Maddie's family has private insurance to cover medical bills that easily top $100,000 a year. Her mother worries that federal cuts could prevent another child from getting life-saving treatment, and changes in the federal law could put her own daughter at risk.
If she doesn't have access to the medications, I don't know what would happen. And we're here in Massachusetts. I don't know where else we could go.
It's your best bet.
Yep.
Stephanie Leyden joins me, and no mother should be put through that. But
in
any case, so just to review, the big fear is Medicaid, a reduction of Medicaid funds, which obviously is we're hugely dependent on to provide health care to low-income people in the state.
Absolutely.
That's the big nut we're worried about, yes?
Right. Pretty much everyone in the healthcare industry, I think folks on Beacon Hill, expect there's going to be a cut. $9 billion we're getting from the feds now. With all these changes, it seems unlikely.
But I thought Baker has said repeatedly, I'm not going to let any more people be uninsured than are uninsured now.
This is huge because we have near universal coverage in part because of the Medicaid expansion. Now, his proposal is that for employers who don't provide health care coverage, and these are employers with 11 or more employees, that for each employee not covered, there would be a fine of $2,000.
Right.
A couple of dozen groups, healthcare groups, community organizations, signed a letter today supporting that proposal, but it's getting pushback from the business community.
So the money may not be there to fill in the gap.
We'll see. I mean, the proposal is underway, but yeah, that's the concern.
Last thing, are people who have employer insurance here, employer-provided insurance, are they protected under state law?
Well, there is no law that mandates employers provide insurance. There used to be. When Romneycare was passed in 2006, there was a provision. Governor Patrick repealed it in anticipation the ACA would take care of it. That never went into place, so we have no mandate that employers provide insurance in Massachusetts.
I was going to say thank you, but I don't think so. Stephanie Leyden, thanks for the information. Seriously.